Hello and welcome, my name is Chris from christopherhole.com. Welcome to this video where we're going to be talking about ligament injuries. Now, ligaments are the tissue that attach bone to bone and they give what's called passive stability. Now, what that means is they aren't like a muscle gets activated by a nerve and the muscle contracts and shortens. Now, ligaments don't do that. Ligaments are what's called passive, so they don't necessarily have a nerve there that contracts them like a muscle, and all they're basically doing is they're like taut bands that hold bone to bone together. They're not active in any way as a way of describing them. So it's a more passive stability more than an active stability that a muscle would give. Then what we get are the different types of injuries that they can have. So you've got a first degree sprain, you've then got a second degree, and then you've got a third degree, which is basically grade 1, grade 2, and grade 3. So with regards to first degree sprain, the fibers of the ligament are stretched but intact. There may well be some small tears, so stretching and small tears. If you've watched the tendon injuries video, again, it's very much the same sort of principle. So stretching and small tears will be first degree or grade 1. Then you've got second degree, which is a tear of part of the ligament from 1/3 to almost all. Again, larger but incomplete tear. Again, much the same as the tendons and much the same as the muscles as they become injured. Then we have the final one, which is the third degree, which is a complete rupture of the ligament, sometimes avulsing a piece of the bone, so taking a piece of bone away from from the bone, if you will. Which again is a complete tear. So much like the muscles and the tendons, the ligaments work in those sort of 3 grades, which is minimal tears or stretching into larger tears into full ruptures. So with regards to treatment, again, it's not anything that's necessarily that groundbreaking. You've got the RICE principle, which is rest, ice, compression and elevation. And then with police, what you've also got in there is optimal loading, which is the O and the L. Now, all the optimal loading means is you're moving it and you're lightly loading it. Now, this doesn't mean loading it with lots of weight. It might just be body weight bearing. So it's very much just thinking about being very cautious with it. But as I've said in other videos like this, these videos here aren't there to sort of diagnose a problem that you've got. Go and see a health professional or a medical professional to get it properly diagnosed, and also go and see a professional with regards to any treatment or rehabilitation. These videos will certainly help educate you about the terminology and what the physio or the doctor may be asking of you, and that's their purpose, not necessarily for you to use and then sort of self-diagnose and then self-treat, if you will. That will be done obviously at your own risk. So hopefully that's been helpful. Hopefully you've gained something from it, and you'll be able to rehabilitate that much more effectively. So many thanks for watching. My name is Chris from Christopher Hole Training, and I will speak to you in a future video.